Okay, so let's talk about Chiari malformation. Chiari malformation is a deformity of the skull, um, and can be. There's several different types. I'm going to talk about the type my daughter has. She has Chiari type 1. And what happens is part of the brain herniates down into the spinal cord because essentially the skull is not large enough for the brain. Her symptoms, what kind of triggered us to further investigate what was going on, were her headaches. So she would have headaches that would come on, and she would vomit from the headache. And the headache episode would last maybe 20 to 30 minutes, and she'd vomit, and then it was over. That was late 2023 into all of 2024. That's the way it was. She had a few episodes where she got the headache in the middle of the night. She woke up and she would vomit. I took her to the pediatrician several times during these episodes, and because of COVID, because of flu season, it seemed like we were just getting brushed off. Here's some Zofran. Okay. I want to say that we didn't always see her primary care physician. We would see the PA a lot of the times because it would be last minute that I would need to get her in to be seen. So finally, at her yearly checkup, her primary decided to order the MRI. The MRI was ordered. She had the MRI of her brain on December the 23rd, and we received the results on December the 26th. I was at work when I got the phone call. I was working with a patient at the time. I had to excuse myself, and I went to the back of the room, and her pediatrician just said, we found something. Your daughter has Chiari type 1 malformation. So she's going to have to be sent to some specialists so we can determine how bad it is, and they'll pretty much take over her care at that time. And at that moment, I froze. I didn't know what to do. I didn't know what to say. I was, trying to process things, and I knew what Chiari was because I've treated patients with Chiari. But it's not that common, or so I thought. So we got that diagnosis. She referred us to a neurologist, and she said that Penelope would need a sleep study, and then we would go from there. So fast forward, I had reached out to some others on Facebook asking, okay, who should I see in my area? Who is a specialist in Chiari? And what I got back was that you need to go out of state. There isn't anybody in our state that specializes in Chiari malformation. And you need to see a neurosurgeon, not a neurologist. So then I started trying to go through some information, trying to figure out who was the best, that was closest to us, and found Dr. Grant at Duke University. So I made a phone call and I spoke with I think she's a nurse, but I'm not exactly sure of her title. But she was very patient with me. She could tell that I was flustered, that I was anxious, that I was desperate for answers. So she sent me a packet. I filled out the packet and sent it back to her that same night. And the process was that you fill out the packet. Um, the care team reviews the information, the MRIs, any other specialists that they have seen, and then they determine if Dr. Grant is going to take on the child's case or not. And that can take several weeks to a month before you get an answer. We had a few hiccups along the way, records not being sent when they say they were sent. That happens all the time. I work in healthcare. It happens all the time. But eventually, we heard back from the care team, and they decided to take her case. Great. Hallelujah. So her initial appointment with Dr. Grant was back in February. Prior to that, she also had her sleep study done, and I can talk about insurance in a different video. Her sleep study, there was an issue with insurance getting authorization, but her sleep study happened on January 29th. That girl, I swear, she got the flu the very next day. She was fine though. But her sleep study came back showing that she had mild obstructive sleep apnea, as well as an episode of central sleep apnea. So then we went and saw an ENT, and now on Monday, this coming Monday, April the 7th, she will be having her adenoids removed as well as a subcapsular tonsillectomy. The ENT does not believe that her tonsils are the issue. She said that possibly her adenoids could be causing some of the sleep apnea. However, she thinks her primary issue is Chiari malformation. Obviously, that is what is causing the central sleep apnea. I'm trying to keep these videos somewhat short, but that is where we are up to this point as far as specialists, except for one that I want to take a separate video with that one. She's seeing a pediatric physical therapist, so I'll talk about that in a separate video. But yeah, she has her surgery on Monday, as well as a full spine MRI. And that full spine MRI is going to give us a lot of information. It's going to give us information about what to do next, what to expect going forward. So there's a lot of things going on here. But I'm going to cut this video off now because that is far too long and I don't have fancy editing equipment yet. I'm still new to this, so what you see is what you get. All right, well, thank you guys, and stay tuned for more information.